I did want to pursue a career in healthcare. So my mom had told us that her older sister was just diagnosed with cancer. So at that time, cancer, we didn't know anything about cancer, and especially at such a young age. I had no idea. To come to find out, she had died from ovarian cancer, which, later I found out that it's genetic. There's a big genetic component to it. There's also, usually when you find out you do have ovarian cancer, it's already too late. So I think that's what happened to my aunt, and so she passed away. So after that, I just kind of developed a love, like, I want to go in to do something in medicine. So ever since then, I thought that I was going to go to medical school, become a doctor, or blah, blah, blah. Came up to BYU, and they had a pre-med department, which I hated because for some reason, they were not very helpful in helping me to figure out my path. And mind you, this was the early 90s. So there was not a lot of polys, I don't think, at that time pursuing medicine, and especially if you're a female. So I had a lot of doubts because I didn't have support from home. My parents were your typical Tongan parents. They were just like, yeah, go to college, go to school, do something. But they weren't really helpful to me in helping me to navigate my education. So I had to figure it out myself. I ended up just figuring out, what, I don't think it's medicine. Maybe I need to pursue something else. I knew that I was going to do something in medicine, I just wasn't sure which area. Later, after having kids, I decided to go back, and kind of looking around at the different options. At that time, I felt like, I think I'm going to try nursing. So that's what I did. I completed nursing school at BYU, loved it. It was such a great program. So grateful that I went into nursing instead because it fit so well with being a mom. So right now, I'm a board certified family nurse practitioner and a psychiatric mental health nurse practitioner. So I had been practicing as a family nurse practitioner for over 10 years. Recently just got certified as a psych mental health nurse practitioner because it really happened around COVID. As we know, there's a huge need for mental health providers. So I wasn't really sure, I didn't even know that I wanted to go into psych, honestly, because I didn't like psych. When I was in nursing school at BYU, that was the last area that I really thought I would be practicing. So during COVID, I thought a lot about it because at that time, we had seen such a huge rise, in the number of cases where people were like, they were struggling, they needed help, but I was only limited in what I knew at the time. So I thought, I wonder if I went back to do some kind of certification, that this would help, in my current role. But so just recently, I got my doctorate in nursing practice and I completed the psych nurse practitioner certification. So I made the switch over and I'm doing mental health full-time. We absolutely need more representation. I think we are headed in a good direction though, because right now there's a lot more Polynesians in medicine, so we're talking about Tongans, Samoans, Hawaiians, just across the board, Pacific Islanders, which I think is great, but we still have a lot of work to do to get people to come into this field to help us understand, because I feel like we struggle. It's not only mental health, but for me, I feel like I really believe that we need a balance across the board with our physical health, our mental health, spiritual health, emotional, like just across the board. It's important that we know how to navigate each area of our health. You put it together, and that's where I feel like we would best be able to cope with a lot of the things that we're struggling with as Polynesians. The first area is just being aware, because we are still struggling with the same issues that we struggled with maybe 20 or 30 years ago. Even, you know, when I was a youth, we still have a hard time talking about it today, which I don't understand that, because with what the statistics show, that we have the highest rate of suicide here across the nation. Yeah, why are we not helping in this area? The latest statistics shows that between the ages of 10 to 19, Pacific Islanders have the highest rate of suicide. So that's all of our youth, that's our kids, that's our young adult ages, right? So why are we struggling with these high rates of suicide? And I think it really first starts with just breaking that stigma and just being aware, you know, and talking about it, because we do not do a good job, you know, in helping ourselves, educate ourselves, being aware, but even just talking about it, we still hold a lot of shame. There's still a lot of stigma behind depression, anxiety, because I think in a lot of ways it doesn't align up with a lot of our cultural values, right? Because of who we are. So we have a lot of work to do. I think first we need to humble ourselves, especially when we're talking about the older generation that's coming in, who grew up maybe back in the islands. We're not aware, or we don't understand a lot of the things that we're facing here in the United States. We need to listen. We need to listen to the kids, you know, because I've seen that a lot growing up. I saw it, you know, in my own family, where the parents are doing all the talking, giving the direction, doing the discipline, and we do very little in listening to the children. Where I can kind of see, maybe traditionally back in the islands, growing up culturally, yeah, that's probably the way that a lot of families were raised, you know, right? The parents are in charge. You do what the parents say. But now that we live here in a different country, a different culture, it's not working, obviously, because our children are growing up, they're confused, because they're being taught one thing in school and they're seeing lots of things in social media and, you know, outside of the home. Then they come home and then they're told, no, you have to listen to me. You have to do what I say. What I tell you is right. So there's a lot of confusion, which then leads to a lot of different problems, including mental illness that, you know, I see a lot of. So I think a big thing that we can do, even something, it sounds really maybe little, but just listening as parents, as adults, just taking the time to listen and observe to your child. It's just something as simple as that. You know, and this is something that I've brought up many times to other people, families, children, is just listen. You would be amazed and shocked at what your kids would tell you, you know, and communicate with you if you just took that time. So what I see in practice is a lot dealing with the medication to help with the symptoms that go along with autism, behavior disorders, you know, all of that. So that's kind of the part that I see a lot of, is to figure out medications for children, youth, adults who are on the spectrum, who need medications to control, most of the time it's like behavior issues, you know, and even depression, anxiety, because as you know, neurodivergency, you're dealing with a lot of that too. We do see a lot of these patients that come into clinic with the symptoms. Sometimes patients come in and they've never been diagnosed and they've struggled for so long that it's clear to us that they've probably been on the spectrum all these years. They just never knew and got the testing. So they always had the diagnosis of maybe depression, anxiety, maybe bipolar, but they continued to struggle, And so sometimes when they come in, I'm like, there's a possibility. There's some neurodivergent behaviors that we see, symptoms. It will probably benefit you and maybe put you at ease to finally get an answer that there was something going on. And that usually is very helpful to us because it guides the treatment plan into what specific medications that we can use to help. Something as simple as language, the way that we use our language to describe a lot of the disorders that we have, as Pacific Islanders, and I will probably talk a lot about Tongan because I'm Tongan, so I know the culture very well. But in order to overcome that stigma of just even the language, I think it's important that we promote and we support and we get the word out and we use it in our daily language, church, school, at home. Depression and anxiety is not crazy, and so part of my presentation that I had to do for my doctorate degree, so my project was focused on creating a toolkit. So looking at the literature, bringing all the evidence from the literature of what little we have, bringing all the evidence and trying to apply it in the clinical setting to help providers figure out what is the best way when Pacific Islanders come and see us as providers. How are these tools going to be helpful so that we can improve the outcomes of mental illness? That's kind of what I was focused on. So in my presentation, I told everybody, and mind you, I'm the only Tongan brown person, I told everybody that the word whakasesele is used a lot to describe mental illness. When I told my colleagues that it translated directly into crazy, they were shocked. Because Palangis, they will not use that. I mean, they're ahead, in understanding mental illness, but it seems so crude and very, very harsh to use such a word to describe somebody who is sick, because it is a sickness. So, yeah, it starts with us, And granted, I know there's a lot of, I have people in my own family who are still learning about mental health and still not aware. Again, I just try to be patient, but it starts with us who are more aware of the subject to promote it, and try to educate people and just try to help to get rid of the stigma. Well, I think I first want to say that I still feel like taking care of our physical health as Polynesians is still a struggle, just like getting us to understand how important it is to, lose a few pounds, get out, go for a walk, maybe you shouldn't eat that third, fourth hamburger, I don't know. Like we still struggle with that, right? So, and I see it all the time. So, and we are very prideful when it comes to these things, because if I tell somebody like, you have high blood pressure, you need to lose a few pounds, exercise, your nutrition is important, like they don't want to hear that. For some reason, I get that pushback and they're like, no, I'm fine. And I started thinking about it, and I was like, I wonder if it has something to do just because of we just don't know. And I really believe that, because like I even had to explain to family members, this is how the heart works. This is what it looks like inside. Because I think as people, if we don't see it or if we don't understand it, because I think there's very little knowledge about how our bodies work. What the brain looks like, how it works, and the connection to the heart, and what a liver looks like, and your pancreas. Like, there's not a whole knowledge, and I don't know if there's any interest. Like, I don't run into Tongan people and they're like, hey, tell me about the liver, you know, and how you know, my alcoholic habits are.
I've seen the same with psychological development. Like, they don't and it goes back to like parenting, you know, which is why like parenting styles can be very like influential on how we develop. But I agree with you. I think it goes back to people just not knowing, and it goes back to them not knowing the effects of our brain and the stages that we go through at each level of our ages, you know?
Yeah. So I feel like that's a barrier in itself in helping us to take care of our bodies, because they just don't understand the connection of, they hear high blood pressure, but they don't make the connection of how it actually works in the body and how you actually can die from a heart attack or stroke. So if we are barely touching the iceberg with physical health, mental illness, we still, because trying to explain the brain and neurotransmitters and serotonin and dopamine, like, you probably would have to have some sort of upbringing maybe, or some sort of, you know, educational background to hopefully understand these concepts, to even make a dent, you know, in our awareness and understanding of mental illness. So yeah, it's hard.
So like with education, it's like we're literally teaching, like we have to teach the very basics and the foundation blocks too. I see what you're saying, because these concepts are too big for most of our people to understand, because they haven't even learned the foundational block.
I mean, that's what kind of, you know, my theory, what I've seen and observed, you know, culturally, because I've had to explain certain things to like family members who did not grow up with the education or the knowledge of how the body works. And so sometimes it is very difficult, you know, and I've heard of people who work as translators in the hospitals who have to translate medical concepts to patients. And they struggle, and they tell me all the time, and even when it comes, and remember, our culture is all about respect. You know, we're very, respect is huge, you know, in our culture, and privacy, you know. But remember, if we're talking about our body parts, that's a very sensitive topic, you know, like for our people. So these translators would tell me that there's no word, like even for bladder, there's no word in the Tongan language for something like bladder. But how are you going to explain it to somebody in Tongan that there's something wrong with their bladder? They don't even know what a bladder is. They're like, what? So if I'm trying to explain to somebody about, okay, this is your brain and, you know, your serotonin receptors, that's not gonna fly. That's probably, so it complicates everything. There's not a lot out there to promote overcoming all of this stigma, including the language. So somebody has to do it. We have to start it. But I noticed that it's a lot easier for us to accept, to go get help if somebody has diabetes or somebody has a diagnosis of cancer or high blood pressure. You know, we take our medication, we try to exercise, eat right, do all the things. But then somebody comes along, you know, and they have depression or anxiety. And remember, the hard part about mental illness is that you don't see any outward symptoms, you know, or signs. Maybe sometimes you do if the person has a serious illness like schizophrenia, you know, maybe bipolar. But I'm talking in general, you know, whereas somebody has diabetes or cancer, high blood pressure, all of that. We are a lot more accepting of that. But when it comes to mental illness, all of a sudden it's like, no, you're okay. There's nothing wrong with you. Just get over it. All you have to do is just, just go to work. You know, maybe you need to repent. Maybe you need to go to church. Maybe you did something wrong in the past and you just need to fix that and you'll be okay. So I don't really understand that mindset, because this is a sickness very much affects a person as much as if somebody has diabetes. Like, the outcomes are not going to be so great if you don't take care of it. I would make recommendations and medications, and they would follow what the treatment plan would be, but as soon as I would talk about something that related to mental illness, all of a sudden it's like shut down. I tell them, oh, you can try this medication. They're like, what? I don't want to take a medicine for that. I'm like, why? You would if you had high blood sugar. High blood pressure is the same thing. So sometimes it worked. For some people, they accepted the help and, you know, they would go get the medication, and then I come to find out later they stopped taking it. They said they felt better. Wow, you did? But then I see the pattern, they would get sick again. They weren't getting well. And then I would just sit there and be like, okay. So if you're telling me if you have high blood pressure and diabetes, you're gonna stop your treatment? You think it's just gonna go away? Yeah, I don't think so. I see a lot of clash between the culture and trying to help our people to get to a better place with their health, both physical and mental. Because I believe the two, you need both. You know, and I'm a big believer in balance. You know, like our lives should be balanced in all areas. It's not really a hidden thing, but the details of what had happened, not a lot of people know, because I am comfortable and feel ready to share because I know that there's people out there struggling. And they're probably sitting there thinking that they're the only ones who are going through what they're going through. And that's the people where I feel like, hey, you're not the only one. Like, I understand both personally and professionally that there is help and there is hope. So we, as parents, we were like your typical Tongan parents, right? You want the best for your kids, you try to teach them and give them all the things because you want to raise good kids. That's basically it. You love your kids. That's the bottom line. But sometimes we just don't know that sometimes our actions didn't really meet the needs of our kids, especially now, the children who are growing up in this generation, in this country, right? And then you think back and I'm like, wow, no wonder they're confused because they're Tongan, but we're telling them to do this, and then they go to school and they see this. I mean, there's just so much. I can just see and sense the confusion that they're facing. And then what happens? They become depressed and they're anxious. They don't know what to do, and then they just feel stuck. So when our son came home early from a mission last year, little did I know that everything I was studying at the time, because I was trying to wrap up this last degree, that I was gonna learn everything that I was learning in the classroom. Literally, I was experiencing it within my home. Like, I saw it. He came home really sick. He could have been part of the next group of statistics of kids who ended up committing suicide, honestly, because he was that sick. And 2024 was not the year. So when I look back, we did miss the signs when he was growing up. Do I have a lot of guilt and shame? Yeah. But I don't feel bad talking about it, because if we don't talk about it, how else are we gonna learn? How else are we gonna share if somebody else is going through the same thing? You know, and in a funny way, it almost made me feel like made me feel more confident and stronger in some weird way, that just by sharing, you know, and acknowledging these things, for some reason, like, I feel like, yeah, I'm gonna be okay. like just push along. So we went through all the things, the depression, the anxiety, trying to figure out what was really going on with him, looking back, you know, for him growing up. You know, we still haven't figured it out today. You know, I'm okay with that. I am totally okay, because the most important thing for me right now is that he's alive. He's alive. When he could have easily not have been. But so many people did not know the details of what really happened, that he got really sick and that he was just at that point. So culture played a lot of things into it, because my husband is straight from Tonga, great person, but had very little knowledge about mental illness. So his way of parenting was your typical, you do what I say, I'm the dad, I'm the parent, I know best. You know, carry on. It did not work so well as I look back now, you know, that my kids are adults, that there were some areas we missed, signs that we missed when they were in high school, when they were growing up. You know, and it's funny because if you have multiple kids, you understand that each child can be different in their own way, yet we're all blood related, but they're all so very different. So now that I look back, you know, and it's funny because, you know, I have 3 boys, and ever since they were little, I would always dress them up the same, cut their hair the same style. To this day, I think that was very traumatic for them. I am so sorry. I did not mean it in that way. I love my kids so much, but I didn't know that those little things would cause so much trauma to their mental well-being. And I can see why. I did not develop their individuality, that they were different in their own ways, and that was my bad. I'm sorry. Yeah, we just got to a point where, for me, the most important thing is that I just needed my kids to know that I love them, regardless. I don't care. Yeah, you can wear whatever you want, but that does not change, right? And we know that's how Heavenly Father feels about us, right? We know that He loves us regardless, unconditional love. So, yeah, culture plays a big part in mental health in general, mental illness, and the way that we raise our kids. Yeah, like it could end up being really good, or it could end up being really bad.
You've talked a lot about like mental illness and then correlating this to being sick. So for viewers who are neurodivergent and they think differently, so if they have something like autism or ADHD, how can we help them feel like they are enough as they are, even though they think differently? And just how can they not see themselves as being like this sick person all the time? Because specifically with the neurodivergency, you can't change it. Mm-hmm. With mental illness, there's treatments to get better.
Mm-hmm. It's important to be aware, you know, and we need to share our stories, you know, which I feel like the whole purpose of this, what you're doing and all of that, is so helpful, because we just don't know, you know what I mean? And that's like the biggest step we need to take as Pacific Islanders, is to, how can we get from not knowing so we can know, you know? And after we start knowing, the next would be, okay, now that we know, we start understanding, so what can we do? Because we can't really do much if we don't know, you know, and we're just labeling these children, they're crazy kids. You just stick them in the corner, because that's what I'm seeing. So one of the things that we are doing, because currently, so I work with the primary organization in the Church of Jesus Christ of Latter-day Saints. So we do have a committee that focuses on children who are on the spectrum, who need more assistance in church settings, and how can we help them grow too? Because we can't just leave them out in the dark and hide them, shut them in the closet somewhere and just pretend like they don't exist. I mean, what's funny too is that I don't know if we're just getting better at diagnosing it. That could be part of the issue, but we see a lot more now in the Polynesian community. A lot more kids who are on the spectrum. You know, as we make our way around visiting different people, you know, where I'm serving, everybody is telling us the same thing, like, what do we do with our kids who cannot sit still, who cannot listen, who have sensory issues? So now we have a committee dedicated to figuring out what can we do. And we've got great people who have not professional like medical experience, but who have their own children, who have tried to navigate the system and helping their own kids, who are coming to this committee and trying to help us put together like, what can we do? You know, and this is on the church, this is in the church setting that, you know, that I'm seeing this, but in clinical practice, I don't see a lot of Polynesian kids. So I don't treat a lot of Polynesian kids who are coming in on the spectrum. Do you know, and in that, I don't know, maybe because maybe lots of people just don't know where to go or what to do with their kids and try to pretend there's nothing wrong with them, but yet the kids continue to struggle, and it's like, there's help. There's like resources to help these children. So that's the clinical setting for me, is that I see a lot of other cultures, but not necessarily the Polynesian community. So I would say first, get the word out. We need awareness, we need to teach people, we need to use it in everyday language, that there is such a thing. But yeah, I don't feel like that's something offensive that we can say, you know, that this child or person thinks differently, and because we see it so much in other cultures, and there's resources in schools now to help these children, you know, and that's like a whole nother topic. I still can't understand why even the way that we educate our children
are like so slow compared to like, the progress that other cultures are making.
Yeah, that's like a whole nother topic in itself. And then I also have issues the way that we educate our kids now in the public school system, and you know, like not everybody's gonna learn the same, right? Like everybody learns differently, but we still have not come up with a good way to help people who are coming in, and to tailor certain things to help somebody grow and flourish and blossom and become the person that they're supposed to be. We think that this one way to teach everybody across the board is gonna help, and no, it doesn't. We still have a lot to work within neurodivergency, I feel like, because we're barely hitting mental illness as it is. And now we're bringing in, you know, autism and people on the spectrum. It's like, so how do we navigate this? Because this is kind of even more complicated to understand, you know, and no parent wants to hear that there's something wrong with their child, and they're gonna need, you know, special, I don't know, resources and things like that to help them. So it's a very delicate, sensitive topic to try to navigate at this time. Signs and symptoms, definitely if your child is not meeting the normal developmental milestones. So if you start seeing that they're not speaking, you know, at the time that most kids should be speaking. If you notice things like they're hyperfixated on certain things, or and it could be very difficult because you know, for younger children, you could just kind of think that, oh, well, they're kids. That's how kids are. But if we are not really paying attention, you know, and remember, those of us who are parents, there's certain doctor visits that you make at certain ages, 2 months, 6 months, 2 years old, 4 years old, or whatever. When you take your child in, the doctor will talk to you about hitting certain milestones for that age. So if they're not hitting those milestones, then we start looking, okay, well, why is there a delay? Why are they not speaking? Or why is this going on? And they're having behavior issues, and we know that lots of kids who are on the spectrum have a hard time making that eye contact, the social cues may be off. They're not getting the social cues. We see it a lot in behavior. They're not able to sit still, and sensory issues. They have issues with maybe like certain textures of food, or we see a lot of that too. For ADHD, I will say that is a whole nother topic in itself. And the reason why I'm saying that is because it can be controversial. For myself, I still feel like we are not really great at treating true ADHD. And what I mean by that is that look around us, the society and the environment that we live, like everything is so fast paced. And our kids, and even us as adults, we are bombarded, right? With so much information at the tip of our fingers. Like you just hit a button and you can search whatever you want, and you are getting so much stimuli from everywhere, where anybody can lose concentration and focus and develop symptoms of ADHD. But is it really ADHD? That's where it gets tricky as providers. And I see a lot of providers, they're very lax in, in the way that they may diagnose and treat ADHD. For me, and I'm just going to speak for myself, clinically, I will be upfront with people who come in and complain of the symptoms of not being able to focus, can't concentrate, they're losing things all the time, they're easily distracted. There's certain screeners that I will go through with them. I will have the discussion with them about the symptoms that they're having, because most of the time, if they're really struggling with ADHD, you will see the pattern. And the pattern really did not start yesterday or even last year. The pattern started way before, but they never knew it was ADHD or related to something with ADHD. So
would you say it's also something that severely affects the way that they function every day? It's not just like a passive, like, oh yeah, that happens, but I can get over it and I can manage it.
Yes, absolutely, because when we are making a diagnosis, we also have to look at how does this disrupt their other areas of life, work, if they're in school. So, and for those of you who don't know, but medication for ADHD, everybody wants to be on Adderall. Oh yeah, give me some Adderall too, because I want to get something done. Right? And if you don't know, Adderall, same thing as meth. I mean, when we know that meth is abused, people use it for the same reason. It's a stimulant, right? Makes you high, makes you get something done, but it's highly addictive. So people, so when I'm talking about ADHD, the line can be blurry, in making a diagnosis and treating somebody, because I also really try to find out how is this affecting their life, and also are they just looking for a medication so they can go to work and be able to stay up and clean their house. I'm like, that is not a good excuse for medication. No. And it's probably not really ADHD, and I feel like we, as providers in medicine, have not done a really great service to people who probably really have ADHD and helping them, because we've just kind of like, oh yeah, just hurry up and give them a medication so they can, and it's up to them if they end up, getting addicted or whatever, because Adderall is a controlled substance. So it's regulated by the state. We can only give out a certain amount. you know, as providers. So, and we can look up the history of how people are getting prescriptions and how much, you know, providers are giving them, all of that, so it's controlled. So I see a lot of that, people come in, and people have gotten a lot better at coming in. I don't know if they memorize the symptoms and they just come in and start spilling things out to me. I'm like, but little do they know I have my antennas up, you know? So I've gotten better at trying to pick out certain questions and trying to really get a good history from them, because that is very helpful to find out, yeah, if it's really ADHD. But those would be the symptoms you would look at. But I also feel like it's also probably underdiagnosed in Polynesians, big time. You know, and I even had recently people tell me like, I think I have ADHD, you know, and after talking to them, I'm like, yeah, I think you do too. And it's sad because they're like already old and like it's affected their whole life, and they didn't realize that it was because of that.